And welcome back. Well, today we're going to tell you how to know the difference between spider veins and varicose veins, and also tell you about a new state-of-the-art treatment so that you can avoid the old-fashioned vein stripping procedures, which sound awful.
Don't they? I know. Things have come
Just
a
the
long way,
name.
baby.
Yes,
Dr. Deborah Manjoney is a vein disease expert and medical director at the Wisconsin Vein Center and MediSpa in Pewaukee. Beautiful
Good to see
location,
you.
too.
Yes, good morning.
Nice to have you. I think a lot of people wonder, they'll see spider veins, they'll hear that they're cosmetic and not a real problem, but also wonder if it's a sign of something more serious. So how do you know the difference?
Well, you can't without seeing somebody who can evaluate it, because spider veins are very common. 70% of women will get them at some point in their life, and often they are cosmetic, and we can tell, you know, if there are just a few of them or if they're in certain locations, but they can cause irritation, they can cause itching or burning, and it doesn't mean that they're not cosmetic, but they can have some side effects that just might not be something that's a medical issue. However, spider veins can also be a sign of an underlying problem in a larger vein. Veins have valves in them so that the blood can go back to the heart and lungs. It's the used blood that's being returned. And so they need valves to prevent gravity from holding blood in the veins. And if those valves don't work, then blood kind of pools there, and that can also lead to spider veins. So this is what we see here. Yes, this is how a vein is, how it looks if you do a cross section of it or a longitudinal section. And we see that a vein can dilate and the valve leaflets can pull apart. And when that happens, there's a lot of excess pressure in the veins in the legs, so we can see symptoms of congestion. And this is what we're worried about, more symptoms of veins that aren't working.
Well, and when you say symptoms, what are some of the symptoms that we feel of venous disease? I know you kind of mentioned some itching or burning with some of the spider veins or other things, but what are there specifics that we should definitely know we need to see a professional?
Well, if somebody's having swelling in their legs and they see bulging veins, yes, you need to see somebody. If they're having achiness, heaviness, leg cramps at night, very often these are all symptoms of varicose vein disease.
I just want to stop you there, because I feel like a lot of people come up with excuses like, oh, I was walking a lot, I was gardening, I'm a waitress, I'm, you know, so there's always some sort of that's why my legs ache, but that's not normal for your legs to ache at all, is it?
Exactly. If you go home every day after work and put your legs up because your legs are just aching and tired, that's not normal, no.
Right.
And even if you work out a lot, eventually you're supposed to get to a point where the workouts aren't always stressing your legs. So this is, I don't know if this is spider, I can't see. There's varicose veins and some of the results we can get. And it's really wonderful because now people do not have to go to a hospital to have their legs treated. We do all these procedures in the office using just injectable local anesthetic, and the results are amazing.
So they can walk in and walk out.
An hour later, walk out.
Do you ever, is stripping ever required anymore?
Not the stripping like the old-fashioned way of stripping, absolutely not. We do remove some of the varicose veins that are really twisty and turny and snake-like because we can't pass a little laser fiber inside of those. So there are lots of different techniques that we use, but everything is done through needle punchers. And so the healing is extremely rapid. You don't need sutures, you'll not have scars. It's really a wonderful, wonderful innovation in treating veins to be able to do these procedures in the office under local anesthesia.
Before you get to some of the exact treatments, what are the problems if you don't treat them?
Well, varicose veins can lead to other problems. So instead of just having symptoms, you may get appearance changes in your skin, because chronic swelling can lead to leathery skin toward the ankles and around the bottom of the calf, and discoloration of the skin. So if you're getting a hyperpigmentation, so pigment is being laid down there, it's much darker, or redness and irritation, a rash, and you're having this swelling, or you have breakdown of the skin with ulceration, or bleeding from a little vein that's near the surface, those are all very important signs that something should be evaluated and something to be done about your veins that aren't working properly.
In your opinion, what's the main reason why, even with veins like this, what's the reason that people go so long without having them treated?
There are a few reasons. Number one, they've heard about the old-fashioned vein strippings and how horrible those recovery times were. It was almost worse than putting up with the vein issues, because they'd be in the hospital, then they'd be out of work for a couple of weeks, they'd have to be laying low at home, a lot of pain, a lot of bleeding and stitching and scarring, number one. Number two, a lot of doctors feel that varicose veins are just cosmetic. And so when somebody has said something to their physician maybe years ago, they would say, oh, you don't want to go through a procedure, this is cosmetic. The truth of the matter is many, many people have symptoms from varicose vein disease, and those should be addressed. And they can be addressed with these very simple procedures.
And can be sometimes covered by insurance.
Almost all the time varicose veins, if they have symptoms, will be covered by insurance.
Okay. I know you're also putting on a talk that you wanted to tell people about.
Right. On February 25th at 6 o'clock, I'm going to be doing a seminar at our center, and we will be talking about venous disease and the wonderful treatments that we do have available. So if you want to learn more, please call our number, and it'll be up on the screen at the end.
Yep.
But we will be having a seminar and being able to answer questions for people. So if you have varicose veins or spider veins and you really don't know what to do about it, just give us a call.
How often do you run into people who lift up their pant and they're like, what is this? Can you tell me?
We do often, but the other thing is, I tend to, when you walk through crowds and in airports and things like that, you always start assessing things. And you see these people say, oh, we could help you, please.
Yeah, I know.
We can make it better.
I know, especially in the summer when you see people in shorts and short skirts. So here's the phone number that you can call. And remember to ask about that seminar. Is it free on the 25th
it
at
is.
6
There's
p.m.?
a reservation. Credit cards needed for reservation, but the seminar is absolutely free.
Okay, so it's free. Be sure to ask about that seminar on the 25th if you have any questions in a very non-threatening environment where you can get a lot of your questions answered. The Wisconsin Vein Center MediSpa is located on Georgetown Drive in Pewaukee. Call this number. It's 262-746-9088 or visit them online at wimedispa.com. Always nice to see you. Have a good
Great
weekend.
to see you. Thank you very much.